Now moving towards basically the passive eruption, which has actually four stages. First, the passive eruption was considered a physiologic process, means it was considered a normal process, but now it is considered a pathologic process actually. So number first, stage 1 is the teeth reaches the line of occlusion. Okay, so the junction epithelium and the base of the gingival sulcus are on the same enamel, means the junctional epithelium and the sulcus is present. Okay, this is stage 1. You can see here the junctional epithelium, which is present on the same enamel, and it is sulcus is also present, and junctional epithelium is also present. Okay, this is stage 1. In stage 2, what happened? The junctional epithelium proliferates, so the part is on the cementum. So junctional epithelium now comes on the cementum, and it is also part on the enamel, but the sulcus is still on the enamel. Okay, you can see here that now junction epithelium has come on the cementum also, and some part remains on the enamel, and sulcus is still present on the enamel. Okay, the entire junction epithelium is now on the cementum, and the base of sulcus is at the cemento-enamel junction. As the part of the junction epithelium, it also proliferates from the crown onto the, means it also proliferates onto the root, but it does not remain at the cemento-enamel junction any longer, and then at any other area of the tooth. Now the junctional epithelium has completely moved towards the cementum, but and sulcus is actually, so they are saying that the sulcus is present on the cemento-enamel junction. Okay, the sulcus is still present on cemento-enamel junction. Okay, now fourth, the junction epithelium has proliferated further on cementum, and the base of the sulcus is now on the cementum. The portion is now exposed. Proliferation of the junction epithelium is on the root is also helped by the degeneration of gingival or pedial fibers and their detachment from the tooth. Means that basically the gingival fibers become degenerated and pedial, and then they are detached from the tooth. The cause of degeneration is not yet understood, and it is believed that the result is due to the chronic inflammation and the pathologic process. So basically, as noted, apposition of bone accompanies also active eruption. The distance between the apical end of the junctional epithelium, means the apical end of the junctional epithelium, and the crust of the alveolus, means that the crust of the alveolus remains constant throughout continuous tooth eruption. Means that throughout the tooth eruption, that the distance which is between the apical end of the junctional epithelium, okay, apical end of the junctional epithelium, and also the crust of the alveolus is basically remains throughout the eruption, which is 1.07 millimeter. The exposure of tooth by the apical margin of gingiva is called gingival recession or atrophy. Means when the tooth is exposed to the apical margins of the gingiva, means it is actually known as gingival recession or atrophy. According to concept of continuous eruption, the gingival sulcus may be located on the crown, means that it is located on the crown, which is cemento-enamel junction, and or the root, depending on the age of patient. Means it also depends on the age of patient and stage of eruption. Therefore, some root exposure with the age may be considered normal or either physiologic recession. Means again, this concept is not actually accepted. Excessive exposure is termed pathologic recession. Means when there is excessive exposure of the tooth, so means it is called pathologic recession. And gingival recession is when the exposure of the tooth is by the apical margins of the gingiva is called basically gingival recession or atrophy.